In this section, we are going to have a discussion of autonomic nervous system. It can be divided into sympathetic nervous system and parasympathetic nervous system. So if this is a rough diagram of the brainstem and the spinal cord, so this is the brainstem, which contains nuclei of cranial nerves, and this part of spinal cord is from T1 to L2. This part constitutes thoracolumbar outflow, which gives sympathetic innervation to various organs, and the cranial part, which consists of nuclei of cranial nerves 3, 7, 9, and 10, as well as sacral segments S2 to S4, they constitute craniosacral outflow, which constitutes parasympathetic nervous system. Now, both sympathetic and parasympathetic nervous system emerge from brainstem and spinal cord, and they provide innervation to various organs, various viscera. Now, if the fibers which emerge from craniosacral region, the preganglionic fibers are larger and they synapse with another neuron outside the central nervous system, and the synapse is called as a ganglion. So the postganglionic fibers which emerge from these ganglions, they go to some organs. For example, they can go to circular muscles of iris present in eye. So this is the parasympathetic innervation, and this ganglion is called as parasympathetic ganglion. Now, the fibers which emerge from thoracolumbar region, they go to the sympathetic ganglia, which are present close to the spinal cord. All the sympathetic ganglia are present close to the spinal cord, and they form a sympathetic chain on either side of spinal cord. The postganglionic fibers which emerge from these ganglia, they go to the various viscera. For example, they can go to blood vessels, where they cause sympathetic innervation. So this is sympathetic nervous system or adrenergic nervous system. Now, an interesting fact to note is that in parasympathetic nervous system, preganglionic fibers are larger in size as compared to postganglionic fibers, whereas in adrenergic system, postganglionic fibers are larger because sympathetic ganglia are present close to the spinal cord. Now let's take a look at neurotransmitters in these systems. In cholinergic nervous system, let's talk about ganglia. In fact, in all the ganglia, that is sympathetic and parasympathetic ganglia, the neurotransmitter is acetylcholine, which is called as universal neurotransmitter in ganglia. The postganglionic fibers, in case of parasympathetic nervous system, they release acetylcholine as a neurotransmitter, which acts on cholinergic receptors, which we'll discuss later on. Now let us take a look at sympathetic nervous system, the neurotransmitters involved. Again, in case of ganglia, the neurotransmitter involved is acetylcholine, that is universal neurotransmitter in ganglia, and the postganglionic fibers of the sympathetic nervous system, the most common neurotransmitter released is noradrenaline, which is the most common neurotransmitter. They can also release acetylcholine in case of the fibers which innervate sweat glands, they cause sweating, and dopamine in the fibers which innervate renal blood vessels, and they cause dilatation of these vessels and thus diuresis. Now the fibers, the preganglionic fibers of sympathetic nervous system, say if this is a spinal cord and these are preganglionic fibers of sympathetic nervous system, they innervate adrenal medulla. The neurotransmitter involved here is acetylcholine, and on this innervation, adrenal medulla releases various catecholamines into the circulation, and these catecholamines then through blood, they act on various receptors, that's various cholinergic receptors. Now let's take a look at functions of autonomic nervous system. As a general rule, we can remember that sympathetic nervous system stimulates the heart, and while as it inhibits all other organs of body, and parasympathetic nervous system inhibits heart and stimulates all other organs of the body. So let us see how does it work. So in heart, sympathetic nervous system increases heart rate, increases force of contraction and conduction, whereas parasympathetic nervous system decreases heart rate, decreases force of contraction. This decrease in force of contraction is minimum because ventricles have less vagal innervation, and it decreases conduction. It can cause various degrees of AV block. In bronchi, it causes contraction of bronchial smooth muscle, which can lead to bronchoconstriction, and sympathetic nervous system causes bronchodilation. In GIT, increased contractions can cause to diarrhea, and decreased contractions by sympathetic nervous system can predispose to constipation. In bladder, increased contraction will lead to voiding of urine, and decreased contractions of detrusor will cause urinary retention. Parasympathetic nervous system will cause increase in watery secretions of glands, whereas sympathetic will cause decrease in watery secretions. And in pupil, parasympathetic nervous system will cause contraction of circular muscles of iris, resulting in miosis, and sympathetic nervous system will cause mydriasis. Now, mydriasis contains the letter D, so D for dilatation. So in this case, pupil is dilated. That's how we can remember it. Now let us discuss impulse conduction in parasympathetic nervous system. If this is a nerve terminal and this is the neurotransmitter acetylcholine and this is postganglionic postsynaptic membrane, and these are various receptors. That's nicotinic and muscarinic receptors. Now, once action potential, it depolarizes the membrane, presynaptic membrane. On the presynaptic membrane, voltage gated calcium channels are present, and these voltage gated calcium channels are activated and they open by stimulation due to this action potential, which causes influx of calcium ions. Now, this calcium is responsible for contraction of certain contractile proteins which are present in the membrane of acetylcholine, and these contractile proteins, they move the vesicle towards the synapse, and eventually by the process of exocytosis, these neurotransmitters, they are released into the synapse. And once released in the synapse, they act on the receptors which are present on the postsynaptic membrane. This can be a ganglion or a muscle and plate or some other organ, and it produces the desired action. If it is a ganglion, then the receptors predominant will be NN, that's nicotinic type of receptors. So these nicotinic receptors, they are actually acetylcholine gated sodium channels, and once acetylcholine binds to these receptors, they will cause influx of sodium ions, and there will be depolarization of this postsynaptic membrane. So that's how action potential from neuron 1, it will be transmitted to neuron 2nd. So there will be depolarization of the second neuron, and eventually action potential will be generated in this neuron. Let us say this is axon of a neuron, and in the exoplasm there is the presence of mitochondria. From mitochondria, acetyl coenzyme A is derived, and the neuron takes up choline from the from circulation, and by the action of enzyme choline acyl transferase, it results in formation of acetylcholine by the transfer of acyl group. Now this acetylcholine will be taken up by a vesicle by the help of a transporter, and this, now once action potential passes through this membrane of the axon, it will cause influx of calcium, and that calcium will cause movement of this vesicle towards the synapse, and eventually by the process of exocytosis, this neurotransmitter, that is acetylcholine, will be released in the synapse. If this is postsynaptic membrane, and say these are receptors, that is nicotinic and muscarinic receptors, now this acetylcholine will act on these receptors and produce the required action. Now this action of acetylcholine is very short-lived, it is almost 1/10,000th of a second, because it is rapidly metabolized by hydrolysis by the enzyme acetylcholine esterase. Now, how does this enzyme metabolize acetylcholine? The active site of acetylcholine esterase, it has two sites. These are esteratic site and anionic site. So this is the esteratic site and anionic site. Esteratic site, it consists of a serine residue, whereas anionic site, it's partly negative charged because of the glutamate residue. So acetylcholine contains acetate and choline, which are bound by an ester linkage, and choline has a partial positive charge because of NH4 positive, so it will be attracted to the anionic site. Now once it will be attracted, the lone pair which is present on oxygen at the esteratic site will attack the ester bond, and it will break this ester bond. However, the enzyme will be regenerated by immediate reaction with a molecule of water. So once a molecule of water reacts with this, ester bond will be completely broken, and it will result in generation of acetate and choline. Now this choline will be recycled again for the synthesis of new acetylcholine, so there will be reuptake of this choline, and this reuptake of choline is the most important step, which is also the rate limiting step in the whole process. So let us see various drugs which can act on this process of synthesis of acetylcholine. A drug called as hemicholinum, it's a structural analog of choline. It resembles in structure with choline, so it will compete with the choline for reuptake by the neuron. Another drug will inhibit this transporter which transports acetylcholine into the vesicle, and the drug is called visamicol. A class of antimicrobials called as aminoglycosides will inhibit the voltage gated calcium channels, and that will halt the process. Now, a group of toxins, that is bungarotoxin and botulinum toxin, they will inhibit the release of acetylcholine in the synapse. Now, botulinum toxin, it's important, it is synthesized by Clostridium botulinum, and an infant with botulism is called a floppy infant, and it results in inability to release acetylcholine, so muscles will not be able to contract. Death can occur due to respiratory failure. Botulinum toxin has therapeutic use as Botox. It is used for migraine prophylaxis, and since it inhibits the release of acetylcholine, so it can be used in cosmetology to reduce wrinkles present on face. Another toxin called as black widow spider toxin, rapidly increases the release of acetylcholine into the synapse and eventually causes depletion of neurotransmitter. So these are various drugs which act on synthesis and release of acetylcholine. And this site, estratic site, it's called estratic site because it is responsible for breaking